AP 120, Chapter 9, Topics Cranial Nerves. So, as we know, the cranial and spinal nerves are part of the peripheral nervous system. They can be carrying sensory information to the central nervous system or carrying motor commands away from the nervous system toward the effectors. The cranial nerves come off of the brain, and there are 12 pairs of cranial nerves. Here are the names. Don't worry, I'm going to go over all of them. So, cranial nerve 1 is olfactory nerve. Technically, olfactory nerve is where the olfactory receptor cells, the sensory neurons, pass through the cribriform plates. So that's technically olfactory nerve. But we tend to instead focus on this structures, the olfactory bulb that lies on the inferior surface of the frontal lobe, and the olfactory tract that then carries the information deeper into the brain. Again, olfactory neurons are the receptors that detect smell, and they carry the information through the ethmoid bone to the olfactory bulb. The signal then bypasses the thalamus. It does not go in the thalamus. Instead, it goes straight to the temporal lobe, specifically the primary olfactory area in the temporal lobe. And that means, of course, olfactory nerve is a sensory nerve because it only carries sensory information, the sense of smell. Optic nerve. Optic nerves, of course, originate from the right and left eyeballs, and they are receiving visual stimulus from the retina of the eye and then carrying that sensory information to the brain. The optic nerves leave the eyeball and then merge at a structure called the optic chiasm. So here's the eyeball, the optic nerve. Here's where the optic chiasm is. Again, optic nerves, optic chiasm. The optic chiasm is near the hypothalamus, and it reorganizes the information, basically switching the medial fields of vision. So your left medial field of vision goes to the right side of the brain, the right medial field of vision goes to the left side of the brain. From there, it of course goes into the thalamus, has to go into the thalamus, and then from the thalamus, the sensory information, the visual sensory information goes to the visual area in the occipital lobe. So we see at the front of the head, we interpret and understand that information in the back of the head. All right, anosmia is the loss of smell. This can be caused by infections of the nasal mucosa, damage to the cribriform plate, damage to the olfactory pathway. Thought that COVID causes anosmia in some people by infecting the nasal mucosa, causing it to swell and cover up the olfactory receptor cells. And then anopia. Anopia is blindness. And blindness can be caused by damage to the eyeball itself or damage to the optic pathway. So one or both optic nerves could be damaged, and depending on where the damage occurs, a person might have partial fields of vision. So they might not be able to see some things, but still be able to see other. All right, next up are these three cranial nerves. These are all motor nerves because they only control muscles. And these include the oculomotor nerve, the trochlear nerve, and the abducens nerve. Oculomotor, trochlear, abducens nerves. All three of these nerves control muscles that move the eyeball. So oculomotor nerve, trochlear nerve, abducens nerve, they all control muscles that move the eyeball. So you can see that's a pretty important function. We have three nerves devoted to it. All right, so if any of those nerves are damaged, someone can get strabismus, also known as lazy eye, as seen here. Basically, one of the eyes is unable to focus on the same object as the other eye. So instead of being lined up to see one thing, one of the eyes is off a bit. And then diplopia is double vision, seeing two of anything, and that could be caused by the poorly lining up of the eyes. It could be caused by the eyes shaking a little bit because damage to the nerves. It could be a lot of things. Trigeminal nerve, cranial nerve 5. Trigeminal nerve is a mixed nerve, so it has both sensory and motor signals passing through it. The trigeminal nerve Sensory information includes touch, pain, and thermal sensations for the facial area, especially deeper structures in the facial area. When you go to the dentist, it is often, as you can see here, this nerve that's innervating the teeth and jaw area, so it's the one that gets numbed by the dentist. And then for motor areas, well, the trigeminal nerve controls some of the muscles important for chewing. So for instance, masseter and temporalis muscle. It also, as you can see down here, innervates some muscles in the tongue. So trigeminal nerve can control chewing. Moving on to cranial nerve 7, this is the facial nerve. Facial nerve is also a mixed nerve. It is more focused on more superficial structures of the face. So it innervates a lot of the muscles that give us facial expressions. So it innervates muscles in the middle ear, facial, scalp, and neck muscles, such as orbicularis oculi, frontalis, etc. The other thing the facial nerve does is it innervates the anterior 2/3 of the tongue, so the front 2/3 of the tongue, and innervates specifically the taste buds. So sensory-wise, the facial nerve carries the sensation of taste or gustation from the anterior 2/3 of the tongue. Now, the facial nerve also controls the lacrimal glands for producing tear fluid, nasal glands for producing mucus, 2 of the salivary glands for producing saliva. And this is all control that we don't think about, so it's autonomic in nature. If the facial nerve gets damaged, a couple of possibilities could include Bell's palsy. So this person here is trying to give you a big smile. However, he's suffering Bell's palsy on the left side of his face, so he's not able to contract the muscles to cause that side to smile. Then aguesia is the loss of taste sensation. So damage to the facial nerve may cause you to be unable to taste things, at least with the anterior 2/3 of your tongue. All right, vestibulocochlear nerve. Vestibulocochlear nerve coming from the inner ear. The vestibulocochlear nerve is a sensory nerve, and it carries the sensations for equilibrium and for hearing. So hearing and also equilibrium, equilibrium related to, say, the position of our head to gravity or the movement of our head. So some possible disorders associated with this damage to this nerve, well, you have vertigo. Vertigo is a feeling that one's body or the environment is constantly rotating, which can be pretty annoying. Ataxia again, difficulty in the voluntary control of muscle movements caused by things like vertigo, things like having difficulty being aware of the body's position to gravity and how the head is moving. Another issue could be tinnitus. Damage could lead to ringing in the ears. And finally, deafness. Damage to the vestibulocochlear nerve can cause someone to have nerve deafness. All right, next up, glossopharyngeal nerve, cranial nerve 9. It is a mixed nerve. Glossopharyngeal nerve, glosso for tongue, pharyngeal for throat. So as you can see, it's innervating some structures in the throat and around the tongue. Sensory-wise, it carries the taste sensation for the posterior third of the tongue. So glossopharyngeal nerve carries the taste sensation for the posterior third of the tongue. It also has receptors in major arteries in the neck, helping to monitor blood composition and blood pressure. Motor-wise, the glossopharyngeal nerve controls some of the muscles in the pharynx that help to control swallowing. It also innervates the parotid salivary gland, which of course is an autonomic motor function. Damage to glossopharyngeal nerve can lead to dysphagia, difficulty in swallowing, and of course aguesia, loss of taste sensation, at least for the posterior third of the tongue. Cranial nerve 10 is vagus nerve. Vagus nerve is another mixed nerve carrying both sensory and motor information. The vagus nerve is special because it is the only cranial nerve that innervates structures in the thoracic and abdominopelvic cavities. So the vagus nerve can innervate structures in the thoracic and abdominopelvic cavities. So sensory-wise, it can relay visceral sensory information from all these internal organs to help convey things like hunger, fullness, discomfort, stretch, that sort of thing. Motor-wise, the vagus nerve helps to control some of the muscles for swallowing, some of the muscles in the larynx for vocalizing or talking, and some of the muscles key for coughing. So it's some of its motor function. And of course, the vagus nerve helps to innervate the lungs, heart, respiratory passageways, and most of the GI tract, which is all autonomic in nature. Accessory nerve, cranial nerve 11. It is exclusively a motor nerve, and it controls specifically the sternocleidomastoid muscles and the trapezius muscles. So muscle in the neck and in the shoulders, which allows it to help coordinate head movement. Head movement, turning your head. So if this nerve was damaged, someone could suffer paralysis of the sternocleidomastoid muscle or muscles and the trapezius muscle or muscles. And this could make it difficult for the person to raise their shoulders or have difficulty in turning their head. And finally, cranial nerve 12. Cranial nerve 12 is the hypoglossal nerve below the tongue, hypoglossal. It is also a motor nerve, and it innervates muscles that help to control the tongue. So muscles that help control movement of the tongue. And of course, damage to the hypoglossal nerve could then lead to dysphagia, difficulty in swallowing. If you have trouble moving the tongue, it makes it harder to use the tongue to move food back to the back of the throat. Those are the 12 cranial nerves.